Hello, my name is Kaylin Anders. I'm going to be doing a neurovascular assessment today. I'm going to walk into the patient's room. I'm going to do hand hygiene. I'm going to ask the patient for their name and date of birth, and then I'm going to ask for her consent to do the exam. Do you consent to it?
Yes.
Okay. So first we're going to start off by doing the perception of, here, so I'm going to grab your arm, and then I'm going to have a object that has a dull side and a sharp side. And then you just tell me whether it's dull or sharp with your eyes closed. Okay, ready?
Okay. Dull.
Mm-hmm.
Sharp.
Mm-hmm.
Sharp. Sharp.
Okay, good job. Thank you.
Mm-hmm.
And then, so that was a superficial touch. And now we're going to do perception of position. So what I'm going to do is take your hand. With your eyes closed, I'm going to move your finger either up or down, and you just tell me whether it's up or down, okay?
Up.
Mm-hmm.
Down. Up. Down.
Okay, perfect. So the next exam that we're going to do is I'm going to put an object in your hand, and then you're just going to tell me what that object is, okay? You just fill it, and then you let me know what it is, okay?
Okay.
So close your eyes.
Can I feel around?
Mm-hmm.
Paper clip.
Mm-hmm. Good job. Okay. So the next exam that we're going to do is I'm just going to touch different parts of your body with your consent, and then you'll just tell me what area of the body I'm touching, okay?
Okay.
So go ahead and close your eyes.
Shoulder.
Mm-hmm.
Right knee.
Mm-hmm.
Right hand.
Perfect. Okay, so the next exam we're going to do is I'm going to draw a number in your hand, and then you just tell me what number I'm drawing, okay?
Okay.
So go ahead and close your eyes.
Do it again. 4.
Mm-hmm. Good job. Okay, so now the next exam that we're going to do is called the 2-point discrimination exam. So what I'm going to do is I'm going to grab your arm, and then I'm going to grab 2 of these pens again, and I'm going to do 2 like this, and then you let me know when it feels like just 1 point. Okay?
Okay.
So, ready?
Mm-hmm.
So how many?
2.
Yep.
2. 1. 1.
Okay. Good job. Thank you. All right. So the next thing we're going to do is we're going to start testing for the reflexes. So I'm going to go ahead and take your arm again, sorry. And with the bell of my stethoscope, because I do not have a reflex hammer, I'm going to go ahead and, so I'll look like this. And I'm going to put my hair just straight out. Yep. My hands right here on the antecubital space. And I'm going to go ahead and hit my fingers with the bell. And I should see a reflex right here elicit. So good job. All right, perfect. All right, so after that, we're gonna go ahead and do the patellar reflex. So I'm gonna go ahead and test the reflex on her knee. So I'll go ahead and have you, you can let it relax, yep. And then I'm gonna hit her knee. And if it just kinda, yep, there we go. All right, and then while we're down here, I'm gonna do her plantar reflex, so if you can remove a shoe, please. All right, and then I'm just gonna take one of this, and you can see right here. So you wanna start at the end of the heel and then come up and do a candy cane, okay? And that elicits the foot, or the ankle, or I guess it would be the foot reflex. And then while we're here, we're gonna do ankle clonus. So we're gonna go ahead and I'm gonna just move your foot back and forth, okay? And then just testing for tremors. So move it back and forth, and there's no tremors, so she's negative for clonus. And then after this, you can go ahead and, so what I want you to do is leave that shoe off, sorry. Go ahead and take your foot and move it down to your shin and do it on both sides. So up to your knee, move down, up knee, move down. Perfect, okay. You can go ahead and put your shoes back on. And then after that, we're going to, let's see, we're gonna do, okay, so you're gonna put your arms straight out and you're just gonna go like this. Okay. We're gonna test your cerebral and proprioception. Yep, good job. And then the next one I want you to do is just go like this and then gradually get faster. Good job. Okay. So next what I want to do is just, can I have you run in place? So go ahead and stand up and just run in place. Yep, that's good. Okay, and stand there. Go ahead and close your eyes. And so this is going to be the Romberg test. So I'm going to put my arms out and we would do this for about 60 seconds. So I would just see if she's swaying or not. Okay, so it's been 60 seconds. That's good. And then after that, I would just go ahead and assess her gait. So if you could just walk this way a little bit. Yep. And then walk back. And then just assessing her gait, see if she's swaying, see if she's moving her arms, her everything, her glide, all that. Everything looks good. So you can go ahead and have a seat. And I think that is it. Thank you so much for doing this. And then I would make sure the patient's comfortable and then do hand hygiene, and that is it.